Health Talk, brought to you by Rapides Regional Medical Center. May is National Trauma Awareness Month. The Rapides Regional Trauma Center has been verified as a Level 2 trauma center since 2012. Last year, it treated more than 2,800 trauma patients.
I would say that the vast majority of trauma we see is related to motor vehicle collisions, ATV accidents, falls, whether that's your elderly that have a fall from standing or somebody falling from a ladder or falling from a roof. Then I think to a lesser extent we do see stab wounds and gunshot wounds, but that's a smaller percentage of our trauma.
As the first Level 2 trauma center in Louisiana, Rapides Regional Trauma Center has received patients from all over Louisiana, as well as East Texas and West Mississippi. Since beginning the trauma verification program in 2011, the Rapides Regional Trauma Center has treated around 11,000 trauma patients.
Initially, I would say that I was surprised by the volume we see here at Rapides. I think that when you take a look at the map and you look at the population centers and all of the facilities that are able to take care of these traumas, it starts to make sense why we have such a big volume here.
The focus of National Trauma Month this year is 3D trauma prevention and focuses on contributors to motor vehicle crashes, drugs and drinking, distraction, and drowsiness. The facts are sobering. Every 2 minutes, a person is injured in a drunk driving crash. On average, 2 in 3 people will be involved in a drunk driving crash in their lifetime. And every day, almost 30 people in the United States die in motor vehicle crashes that involve an alcohol-impaired driver. This amounts to 1 death every 51 minutes.
In general, when you're talking about motor vehicle collisions, you're talking about 2 types of patients. You have the patient that's restrained and is wearing a seatbelt, and then the other category of patient would be your unrestrained patient, somebody not wearing their seatbelt, and really due to rollovers, ejections, or partial ejections where they can then be rolled over by the vehicle, all bets are off in terms of the type of injury they may have. And the severity is, as you might expect, much greater.
For more information, visit rapidesregional.com.